So, good evening. Welcome back to Krok 2 intermixing further. We're going to be completing file 2 on this very video. So, yes, a hypertensive patient, and that left ventricular hypertrophy is common to patients that have chronic hypertension, and that's the same cause of the thinning of the cortical layer of the kidneys here with the proteinuria. So, the question: what's the primary diagnosis? It's very simple in this particular case. It's essential arterial hypertension. Yes, it's that simple. Don't think of something else. So if a patient is having meningitis, you see, reading out the question, and you can have epidemic cerebrospinal meningitis. If a patient is having meningitis, what will you do to confirm it? You do a lumbar puncture, check for CSF analysis. Okay, you see, in this particular patient, they are not telling us about a specific allergen. They are not telling us about a toxin or a poisoning. They are not telling us about a microbial infection or a underlying basis for microbial infection. So these presentations: vesicles following erosion recipient serous discharges, discharge, inflammatory nodules, redness and swelling that are later replied by small inflammatory nodules. These are typical for true eczema. Alright, this in this particular case, it's not so complete anyway to have printed directly to secondary syphilis. However, palm and sole is covered with multiple lenticular disseminated papules. There are some of the things that point our attention to secondary syphilis. So we see history that we point to it. Callosity. This is due to friction points in the body. So here is secondary syphilis. Patient is having food poisoning, and similar to our previous cases, botulism is closely associated with double vision and difficulty swallowing, dysphagia. And we could see also that the previous evening that the patient had dinner with canned food because Clostridium botulinum is an anaerobic organism. So this is botulism. Alright, this is a GI infection. You are seeing stools, frequent stool, abdominal pain, liquid stools, and so on and so forth. However, there is tenderness all over colon segment, and sigmoid colon was found spastic. Anytime they give you a detailed information about the sigmoid colon in an infectious disease, we almost always be right to take your answer to be shigellosis or dysentery. So this is acute dysentery. Dysentery causes that. Alright, this is a patient with paroxysmal or episodic arterial pressure increase, and is so high, 240/120, and you know that this, together with hyperglycemia, I'm sure you are thinking about something caused by catecholamines, by epinephrine. This is pheochromocytoma, a tumor of the adrenal medulla. And how can you confirm diagnosis of pheochromocytoma? You determine the urinary excretion of catecholamines and vanillin-mandelic acid in urine. This is a metabolite of catecholamine. So we have a patient with history of asthmatic attack, and the question is saying, what disease do we suspect? Eosinophilia is 15%. You can see arterial blood pressure is very high. So right now, together with joint and sensory disorder of legs and skin, what fits best is a small vessel or medium vessel vasculitic disease. That's what fits best in this particular case. And if it is scleroderma, they will tell us about esophageal difficulty in swallowing, that is, and other things about Crest syndrome. Systemic lupus, they give us things that relate to it, butterfly rash. So it's not this. So we are left with these two options. But this is a granulomatous disease, but in this particular case, our best answer is periarteritis nodosa. Wegener is also a vasculitic disease, but it is a granulomatous disease. A patient that is suspected to be having myocardial infarction, not responding to nitroglycerin. whenever they ask you that, okay, so which drug can the patient use to reduce heart need for oxygen without aggravating the disease, the best thing to use after nitroglycerin has failed in this kind of question is isosorbide dinitrate. So what's the suspected cardiac disorder in a patient with pulsating neck, with pulsation in the head and neck, with fear and nausea, see, sudden palpitation? So this is paroxysmal. In paroxysmal tachycardia, they tell you of sudden palpitation. So this lasts for 15 to 20 minutes and is over after training when holding a breath. So most likely is a supraventricular paroxysmal tachycardia. Alright, we've done something similar to this before. Patient is having papules, rash that is paired. When you see it's paired, you think of scabies. When it's the itching is especially at night, you think of scabies, and so on. Flexor surfaces of the arm, you think of scabies. So scabies. Alright, this is a welder having first degree burn. First degree in burn patients usually have infectious complications, and one of the most common organisms in such condition is Pseudomonas. So here we are having first degree burn of the middle third of right chain. So 5 days later, the skin around became edematic and itchy. So together with all these discharges, pustules and everything, that this is an infectious complication, and the best answer, since it's 5 days after the major burn, is microbial eczema. See, a patient is having type 2 diabetes. We know, yes, that the use of insulin is for type 1, but when a patient is in need of urgent surgery, patients that are going surgery and is having type 2 diabetes or mellitus, the chance that insulin is going to be used in the regulation of the blood glucose is very high. So this is a patient that's having wooden belly. This is urgent surgery like an acute abdomen, and need to conduct a surgery on this patient. So what is the most appropriate way for further treatment of diabetes in this particular patient? So it's to administer a short-acting insulin. This is an alcoholic dependent patient for 20 years. So weight loss of 8 kg over 2 years, over a period of 2 years. You see blood amylase 12, physics, neutral fat 15 gram per kg, starch grains. So patient is already having chronic pancreatitis and is having difficulty in digesting fats and carbohydrates. So what do? You want to give a drug that contains these enzymes, and that is pancreatin will do that for you. So I said before that Contrical, it's actually pancreatitis in treatment also, but it's acute condition. When you hear that a patient is having edema on the right leg, and that particular spot is bright red spot in form of flames, like hot sensation, which feels hot, this points your attention to one infectious disease, is erysipelas. This is typical for erysipelas. Alright, we have a patient whose skin disorder is associated with spring or with seasonal changes, and we have peripheral growth and fusion, 2-year history of disease. The patient's father had the same or similar skin lesions, so this is a genetic, hereditary kind of disorder. And you will notice that objective examination revealed guttate-like nodules. Guttate, maybe you must have heard the word of guttate form of psoriasis before. So this really helped us in having our answer to be psoriasis. So guttate form of psoriasis, about 4 or 5 forms of psoriasis that we have. Guttate is one of them. Reading through this question, it looks so familiar. It's clear that this is a patient with chills, body temperature up to 40, lasting up to 7 hours, then patient came on the 7th day of disease, subatheric sclera. This is similar to malaria. significantly enlarged liver and spleen. This is malaria. And when a patient is having fever attack or like malaria that is just on exposure, it's called a patient just arrived from Africa and is within few days, the face of this malaria disease is in the erythrocytic schizogony. There is the face of erythrocytic schizogony. There is the face of tissue schizogony. In tissue schizogony, this is the chronic form of malaria, in which later the malaria is going to reoccur even when the patient has not been bitten by the Anopheles mosquito, because we have the tissue form that is for the relapse. So, but here is erythrocytic schizogony acute. You have a patient that is having signs of meningitis with temperature, and you discover that patient is also having headache and repeated vomiting. So together with meningitis, you are thinking that the cause of this headache and vomiting right now is increase in intracranial pressure. We've said this over and over. So this increase in intracranial pressure is the leading symptom that is causing this disease. They said the leading symptom of this disease is caused by what? So it's the liquor hypertension. The liquor in this case is the cerebrospinal fluid. This question, we have a repetition. All right. A patient that is having shooting heart pain, dyspnea, cardiovascular presentation, shooting heart pain especially. And then you can read all through, but what I'm mostly interested in right now is the fact that she had acute respiratory disease a week ago. So you are thinking of an infectious complication in the heart. And this shooting heart pain is similar, is very it's something that you can find in myocarditis. So this is acute myocarditis. Please don't confuse it with rheumatism, atrial insufficiency because of this presentation, because it's likely to also mix it up with rheumatism. So we have a question, a 63-year-old patient. And if you read through, these are signs of anemia. Patient has been suffering this for about 15 years, but tells to revealed parental cell antibodies. So antibodies against parental cells. Parental cells are responsible for the release of intrinsic factor which binds to vitamin B12 for its absorption. So when that is impaired, the patient is going to have vitamin B12 deficiency anemia, so-called what we call the pernicious anemia. So yeah, what is the most likely reason for the development of anemia in this patient is because there is production of antibodies to intrinsic factor, that is pernicious anemia. Okay, you can see that this is a patient based on the symptom that is having severe asthma. Severe asthma. What medication should be prescribed to prevent attacks of bronchial asthma on the first day? So this is about prevention. So you want to use something that can like a pathogenetic treatment over a long period. So you use a drug in this case that can stabilize mast cells. So that is cromolyn sodium. Alright, we have elevation of body temperature with pain in the left side of the thorax during 2 weeks. You can read further and everything. Sharply weakened breathing over the left lung. Sharply. This is very typical together with the above presentation of together with temperature of exudate pleurisy. You may not really have temperature in others, but in pleurisy you have sharply weakened breathing. Alright, we have a patient that is undergoing dehydration, that is being dehydrated due to multiple vomiting and frequent watery stool. So whenever the tongue of a patient and skin are dry, you're thinking of dehydration. So blood pressure is 80/40. Patient is in shock. What is the cause of this? It's dehydration. Why do you reverse it? You give the patient fluids, and how do you do that? Is by intravenous injection of sodium solutions. It has a way to calculate it. Our teacher taught us like 1 or 2 weeks ago, and maybe one day I'm going to make a PowerPoint presentation on how to get about that. 42-year-old female patient suffers from micronodular cryptogenic cirrhosis. Over the last week, her condition has deteriorated. She suffered convulsions, mental confusion, progressing jaundice. So the question here is, since we are having cryptogenic cirrhosis, what is the link between liver? This is liver cirrhosis. What's the link between liver and the brain? Since they are far apart, that is ammonia. So we are talking of hepatic encephalopathy. So you determine serum ammonia. All right. If patient is using furosemide for the treatment of heart failure, and yet the patient developed bronchopneumonia, you need to treat with an antibiotic. And as a result of the side effect of this antibiotic, patient is having hearing loss. So which antibiotic can possibly cause hearing loss? We are talking about gentamicin. This is an aminoglycoside which have side effect of ototoxicity, nephrotoxicity, and cardiotoxicity. This is straight to the point. You can see the X-ray signs typical for rheumatologic disease, especially rheumatoid arthritis. But the most important thing pointing here is the proximal recurrent pain in the proximal interphalangeal and wrist joints. Proximal rheumatoid arthritis will show us pain in or signs of inflammation in the proximal interphalangeal joints. Why, if it is distal interphalangeal joints, you can think of osteoarthritis. So in this particular patient, it's rheumatoid arthritis. Every time, like Krok is quite predictable. They don't tell you about serum ferrum, that is iron. They don't tell you about it for fun. So when you are having patient with anemia, you can see hemoglobin very low, color index of 0.7 is revealing hypochromic anemia. Also, in deficit of what factor causes development of diseases? It's very simple: iron, ferrum. Okay, we have a patient with duodenal ulcer. Now the pain is permanent and persistent, yet blood pressure is normal. This is penetration, duodenal ulcer penetration. If it is perforation, you may have similar things, and then patient will start developing shock because patient is going to be losing blood. However, blood pressure is normal, heart rate is normal, then you still think that this is complication of this is penetration, not yet perforation or bleeding. See, this patient is having dyspnea on exertion, heaviness in the right hypochondrium and shear edematha towards evening. You can see that the blood pressure, the temperature is elevated, blood pressure is elevated in the lungs. Single dry rails can be auscultated. Hearts are muffled, ECG, RB1, SV5, 15mm, X-ray picture showing bulging of pulmonary artery cone, right ventricular enlargement. What is the most likely cause of this condition? Actually, this is a pulmonary heart or like cor pulmonale. This pathology that we are observing there is a sort of cardiac or pulmonary disorder. So bulging of the pulmonary artery cone and right ventricular enlargement. Please don't confuse this question with primary pulmonary hypertension. A 30-year-old female patient has been delivered to hospital for sudden dyspnea, progressing to asthma, sensation of having a lump in the throat. You might start thinking, oh, this is goiter, this is something that is affecting the thyroid gland, arm tremor, tartessicosis. But patient is having fear of death, and the attack has developed for the first time and it started with strong emotion. When I'm hearing something like this together with signs of tartessicosis, I'm thinking that this is a neurocirculatory asthenia or neurasthenia. We have almost the same presentation here. Patient is having such presentation, and patient is 24-year-old emotionally labile woman. You see, attitude changes, ECG is normal. The most probable pathology is that when they tell us about the emotion of the patient, because she was following her divorce, so This is also neurasthenia. A patient is having chronic pyelonephritis. Daily, like if you have a diuresis of 100 ml per day, daily diuresis of 100 ml per day is anuria. This is indication for hemodialysis. Creatinine is elevated, the kidney, we have acute, we have like chronic kidney insufficiency, so we are treating this patient on hemodialysis. Some patient could have need of it as much as 3-4 times a week. A patient had macrofocal myocardial infarction. Myocardial infarction. You can see blood glucose level, okay, 5.9, not too bad. It's 150/90 arterial blood pressure elevated. But which risk factor should be urgently eradicated during second prevention? Which one do you want to really focus on more that can actually even bring others to come down? See, patient is obesity 36%. So you want to correct this risk factor. Please don't be quick to choose because you've seen the word pesticide in the question. Don't be quick to choose organophosphate pesticide intoxication. No. He said a month ago, after all this presentation, she had a severe domestic poisoning with some pesticide. Patient cannot remember the name. If this is the intoxication, this is a month ago. This is pesticide works faster than that. So in this case, she has a 7-year record of working in contact with petroleum products, particularly benzene. So there's a chronic exposure. So this is benzene intoxication. Probably you've had a classmate who suffered this before, who experienced it, or someone who experienced this. You can see blood pressure low, but what's the cause of it? The patient, 19-year-old patient in a stuffy room. What happens to somebody in a stuffy room who suddenly became unconscious? That is syncope. All right. Bulky, fruity stool with greenish mucus. You have mucus sometimes falls in the feces, together with body temperature that is elevated, cramping, pain in abdominal. You are thinking of salmonellosis. However, they are also telling us that patient is consumption of soft boiled eggs. I hope I can get some boiled eggs this evening myself, but without salmonella. All right, a hypertensive patient. When you read through the questions, are signs of hypertension in the patient, but it is due to Cohn's syndrome. In Cohn's syndrome, we have excessive secretion of aldosterone because the somnal glomerulosa is affected. There's excessive secretion, tumor of adrenal gland cortex, especially the zonal glomerulosa, and you have aldosterone being released in high amounts. What do? You want to treat with a drug that can block the aldosterone receptor. And here we are going to be using a diuretic that also have aldosterone receptor blocking property, which is spironolactone. Please, the answer of this question is not echo. It's not echo. Percussion reveals that heart borders are displaced to right and left by 1 centimeter. A square systolic murmur with its epicenter within 4th intercostal space on the left. What is the most informative examination to confirm clinical diagnosis? Notice in this particular patient, 4th intercostal space on the left. We have right and left eye. So majorly we are getting the point that the ventricles are enlarged. But it's not so much about the valve right now. So let us go directly to the ventricles. Just to help us in this particular question anyway. This ventriculography. Alright, patient with pulmonary disorder, blood stroke sputum, will be pointing attention to tuberculosis, to lung cancer, and so on. But the chest radiography shows a globular shade of 4.6 centimeter. When they are so specific like this, you are thinking of tuberculoma, you are thinking of lung cancer. However, history will point for that as tuberculosis, but in this particular case, we don't have such history. This is a peripheral lung cancer. 18-year-old patient has subtotal stromatectomy due to malignant capillary cyst adenoma of thyroid gland. In 2 months, there was suspicion of metastasis presence in the lungs. When you suspect metastasis in the lungs, even though it's metastasis, I know in some countries the best thing to do when you're suspecting metastasis in the lungs is to do a CT, spiral CT, or whatever. But here, these lungs always start with X-ray, and if they are asking us what röntgenological study is used first. They didn't say is used, they said first. So if it is first, please do your normal chest X-ray. It's very cheap. Patient is having skin cancer, first stage, 0.5 centimeter deep in tissue. Tumor is localized in right nasolabial region. See the region, very dangerous zone. And for its first stage, what do you want to do? The first thing is we can use some radiation therapy, but because of the size of the tumor and because of its location, we make it a short distance, that is to focus directly on the tumor. So we are having a short distance röntgenography or therapy. Initially when I saw this question, I thought it was going to be surgical adjustment, but no, it's a short distance röntgenography. Everything is low in this case. And what's the cause? Probably we are thinking of immune thrombocytopenic purpura, possibly. You can see multiple bruises on anterior surface, nasal hemorrhages. These are the most common symptoms in this patient. And when you are, what is the most effective measure for the treatment of thrombocytopenia? One of the effective method is to do a splenectomy. Now, you don't give transfusion of platelets. I heard of that the indications are when platelet is less than 10, and even sometimes less than 10, you don't transfer platelet until there's bleeding in the patient. So this is splenectomy. 2 days ago, patient presented with acute pain in the left half of chest. See, when you see acute pain in the left half of chest, and you are seeing the vesicular rashes, you see group of vesicles between 4th and 5th rib. This is following, when they tell you that such pain with the rashes is following along the course of the rib, that means it's following along the course of a nerve fiber. That is herpes zoster or shingles. You know, they are actually reserved in the nerve ganglion. So herpes zoster. All right, when you have a patient that is having LASEG and urinary tension or signs positive, together with lumbar actually strained in the lumbar part of the spine, right ankle reflex is absent, what disease can you suspect? Majorly, you can narrow it down to lumbalgia and lumbosacral radiculitis, but in this particular patient, the lumbalgia is just going to be like about pain in the lumbar region, but you can see further symptoms manifesting here, and Achilles reflex is absent. So, lumbosacral radiculitis, this is radiculitis. Okay, I would like to see a comment under this video about why warming procedures is contraindicated for acute lumbar radiculitis. This is the effect of warming procedure. Please. I think it has to do with muscle tension and so on. So a patient is having methanol poisoning. Blood contains methanol. So we have blood contains methanol poisoning. How do you treat methanol poisoning? We treat with ethanol. Treat methanol poisoning with ethanol. Naloxone is antidote of opioids. Alright, 2 more to go. So the same thing is a patient that's suspecting also like signs of radiculitis, just like the similar question we read. After reading through everything, like 6 signs positive on the right, what additional tests should you perform in the first place? Just like the question we just read, and the answer was Retinography of the lungs. Here also, you can see they are asking us in the first place. It is so cheap to do X-ray, so do it first. If you miss anything there, then go further to CT and other imaging. So this is still radiography of this spinal column. And our final question for the day: please don't try this at home. A female 20 years old after smoking noticed a peculiar inebriation with the feeling of burst of energy, elation, changing of surroundings. The world gets full of bright colors. Objects change their dimensions. People's faces get cartoon features. You don't want your friends to look like cartoons. Loss of time and space judgment. What is the most likely diagnosis? This patient is high on cocaine. High on cocaine. Cocaineism. Okay. Have a beautiful evening.